This video will talk about what HIV is, effective ways of preventing the transmission of HIV, and the services available in Leeds that young people can access. So what is HIV? HIV stands for Human Immunodeficiency Virus. HIV is a virus that damages the body's immune system so that it cannot fight off infections. It is most commonly transmitted through vaginal or anal sex without using a condom. AIDS is different to HIV. AIDS stands for Acquired Immune Deficiency Syndrome. It is the name used to describe a number of potentially life-threatening infections and illnesses that happen when your immune system has been severely damaged by the HIV virus. AIDS cannot be transmitted from one person to another. Due to the progression of treatment for HIV, most people with HIV will not go on to develop AIDS and will live long and healthy lives. People living with HIV who are on effective treatment can reduce their viral load to undetectable levels. This means that they are unable to pass on the HIV virus. In other words, it is untransmittable. At this stage, people living with HIV who have condomless sex would not pass on the virus. An easy way to remember this is undetectable equals untransmittable, or U equals U. 98% of HIV positive people in England who are on effective treatment cannot pass on the virus. And in Leeds this is 98% too. However, it is important to remember that although the virus would not pass on, the risk of STIs and unwanted pregnancy is still possible. Whilst HIV is preventable and treatable, there is currently no cure. Therefore, if someone thinks they have HIV or may have been at risk of HIV, it is important for them to get tested as soon as possible. The sooner they are diagnosed, the quicker they will be able to get treatment, which increases the likelihood of having an undetectable viral load and preventing further problems. Ways of preventing the transmission of HIV are condoms. When condoms are used correctly, they are an effective way of preventing the transmission of HIV, as well as protecting against other STIs and unwanted pregnancy. If the condom has not worked, for example if the condom splits, it is important for the young person to take an HIV test and to also test for chlamydia and gonorrhea. However, if the person has symptoms, they should attend the sexual health clinic in Leeds to test for all STIs. PEP. PEP stands for post-exposure prophylaxis. It is a medication that can prevent an HIV infection after the virus has entered a person's body. A person can take PEP if they think that they have been at risk of getting HIV. For example, they have had unprotected sex with a partner or partners who have HIV or may have HIV. The barrier methods they used during sex did not work, or they have been sexually assaulted, raped or abused. PEP is a 28-day course of medication and is only recommended after high risk of exposure. It needs to be started within 72 hours of exposure to the virus, but is more effective the sooner it is taken. PEP can be accessed from the Sexual Health Clinic in Leeds, emergency departments such as Leeds General Infirmary and St James's, and Sexual Assault Referrals, or SARC for short. The SARC in Leeds is called the Hazelhurst Centre. PEP cannot be accessed from a GP or pharmacy. PEP does not prevent any other STIs. PrEP. PrEP stands for pre-exposure prophylaxis. It is a medicine for people who do not have HIV and take to reduce the risk of getting HIV. When taken correctly, it offers near complete protection from HIV. PrEP is not a vaccine and does not prevent any other STIs. Some people will take the medication before and after sex, and others will take it daily. The Sexual Health Clinic in Leeds will advise the young person on how to take it that will be the most effective for them. A person can take PrEP even though they also take hormonal contraception. It is a very effective prevention method for people at risk of HIV, especially for those who may find it difficult to use condoms every time or are unable to negotiate safe sex. PrEP is available for free on the NHS from sexual health clinics. PrEP is not available from a GP or pharmacy. Most adults and young people aged 16 years old and over who are HIV negative can take PrEP. It may sometimes be prescribed for people under 16 who are at risk of HIV. PrEP should not be prescribed to anyone below the age of 12 years. People who can benefit from PrEP are people who do not always use condoms for sex and do not know their HIV status, people with current or previous HIV positive partners who do not have an undetectable viral load, people with current or previous partners from an area with high rates of HIV, people who are from an area with high rates of HIV, people who engage in chemsex, this means using drugs to enhance their sexual experience, men who have unprotected sex with men, and other people who have unprotected sex with men who have sex with men, trans or non-binary people who are regularly having unprotected sex, people who share sex toys with someone who is HIV positive and they do not have an undetectable viral load, people who are not able to negotiate safer sex, people who exchange sex for money, drugs, shelter or another reason, and people who inject drugs and share equipment. To find out more about PrEP, including who is at risk of getting HIV and at-risk activities, visit www.nhs.uk/medicines/pre-exposure-prophylaxis-PrEP. Leeds Sexual Health is a service that offers STI screening and treatment, HIV testing and treatment, and contraception services. You can find out more about the services they offer at www.leedssexualhealth.com. To find a sexual health clinic in Leeds, please visit www.leedssexualhealth.com/services. If you want to find out more about PrEP, U=U, or HIV, or want to get help and support, then the following services offer a wealth of information and support. Yorkshire Mesmac offers services to various communities across Leeds, including men who have sex with men, people from marginalised communities, people misusing drugs, sex workers, and LGBT+ people. They offer advice, counselling, support and information around sexual health and offer services such as STI and HIV testing. Find out more at www.mesmac.co.uk. BHA Skyline offers both emotional and practical support services across Leeds. Their services include peer mentoring, counselling, support and activity groups and one-to-one support. They also provide information, advice and advocacy, emotional support and massage therapies. Find out more at www.thebha.org.uk. The Terence Higgin Trust is a national voluntary sector provider of HIV and sexual health services in the UK. They support people living with HIV and amplify their voices and help the people using our services to achieve good sexual health. As well as provide services, they campaign on issues such as relationships and sex education in schools. Their website provides lots of useful information. Find out more at www.tht.org.uk. Brook is a national charity that offers both clinical sexual health services, education and wellbeing services for young people, plus training and support. Their website offers lots of information, including resources, to equip you with everything you need to provide exceptional relationships and sex education and wellbeing support to young people. Find out more at www.brook.org.uk. And then there is Children's HIV Association. This is a national charity where their mission is to ensure that children, young people and young adults growing up with HIV become healthier, happier and more in control of their own futures. Their website has a wealth of information for both young people, parents and professionals. Find out more at www.chiva.org.uk.